Now, for the last 7 years since the Affordable Care Act had been passed, Republicans have been promising an alternative plan. This plan will be faster, better, stronger. Oh, wait, that's the $6 million man. Actually, no, they promise it will be cheaper and have more choices and freedom. Whatever that means. Freedom, I don't know. But maybe, I don't know. Freedom and cake. Except that there is no cake. And there's a Republican senator that just admitted this. Now, this is Mike Lee. And he was talking to KHN's Julie Reuner about this. About why they're pushing the repeal of the ACA so fast without a replacement. Now, they say it's because if people saw the Republican alternative, they might not actually like it. Mike Lee says, quote, "There's a lot less agreement about what comes next. If we load down the repeal bill with what comes next, it's harder to get both of them passed." Meaning that if you actually put what's in it in a bill, in the same repeal bill, people will get a chance to look at it. We'll get a chance to talk about it on these different shows. I'd certainly talk about it, what's in the repeal, and I've seen and talked about some of the stuff that they plan to replace it with. Those are things that are not popular. Now, again, speaking of popularity, full repeal, not exactly popular. Just 18% of people polled by Quinnipiac last month want the ACA fully repealed. 47% want some of it repealed, likely the mandate. And 31% say, leave this shit alone. Just leave it alone. It's fine. Don't get rid of it. Look, I'm one of the people that actually say, let's change some things. Let's make it better. Let's put in a public option, for example. But that's me. This is a Republican bill, so likely they're not thinking that way. But anyway. No. Again, Lee says he's in favor of a full repeal. He really wants to just get it gone in one shot before having a replacement. However, if you can't have a full repeal, he'd at least take a partial. At a minimum, Lee said, Congress should immediately pass the bill it passed in 2015 that was vetoed by President Barack Obama. Now, that partial repeal would have eliminated the expansion of the Medicaid program for the poor, as well as all the insurance subsidies that help people afford coverage and the taxes that pay for that program. So consider this, right? See, those aren't the unpopular parts of the ACA. Those are actually popular. The unpopular stuff, the mandate, would still be there. But the subsidies, gone. Medicaid for the poor, gone. Some of the taxes that help pay for those subsidies, gone. For example, if they get rid of those taxes that they use to base the subsidies from, well, the richest 400 households would get a tax benefit of $7 million a year. That's why they're doing this. They want to get rid of those taxes. And for Medicaid for the poor, they don't care about poor people. They don't give a fuck about poor people. They don't give a fuck about people on Medicaid. Gone. They want to get rid of it. And in fact, Lee says, quote, if we can get something more aggressive, then great, but we cannot make progress until we first repeal Obamacare. Now, what is their plan? Well, there's really nothing cohesive at this point, but a lot of the ideas that are coming out are equally bad. For example, health savings account. Health savings account. Basically what you do is that you take your own money, you put it tax-free into a health savings account. And when you get sick, you use the funds from that to pay for your care. Now, that's great if you break your finger or something. But if you get cancer, wiped out. Gone. And then you're screwed. You're SOL. Then, of course, but that's okay. Their other plan is to put in a small tax break for people. So you can save a little bit more of your money and you can put it into that health savings account. Again, you get cancer, SOL. It can cost hundreds of thousands of dollars to treat cancer. Regular people don't have that lying around. Even with that small tax break and that incentive to go and put money into a health savings account. It's ridiculous. It wouldn't work. And of course, there's nothing to pay for the promise of keeping people with pre-existing conditions covered or allowing people with pre-existing conditions who don't have insurance currently to get that insurance. That whole Bernie Sanders versus Ted Cruz town hall talking about the future of the ACA, well, Ted Cruz kept saying, oh, don't worry, they can keep their health insurance if they have a pre-existing condition. Well, you didn't say anything about anyone who didn't have health insurance and has a pre-existing condition. Because if you drop all those requirements that that insurance companies cover people with pre-existing conditions, if you already have one, and there are some crazy things that are considered pre-existing conditions, by the way. One of them includes pregnancy. It's crazy. But, hey, if you've been pregnant, man, pre-existing condition, we're not going to cover you. That's insanity. So, again, no, there's really no cohesive plan, and that actually works in their favor. Because if you're vague, well, then you can keep whipping people up for the repeal first. Yeah, repeal, get rid of it. It sucks so bad. The ACA sucks so bad right now. We got to get rid of it. When you whip people up, then it's a good chance that they might not ask, but what are you going to replace it with? You keep the focus on repeal, nobody asks about replace, except there seems to be a lot of people asking about replace. But, again, their replacement plan likely to be worse. And why? It's because the Affordable Care Act was their plan. They don't have anything better up their sleeve, anything that actually works up their sleeve. And look, again, the ACA has its problems. After all, it is the Republican plan, as I keep mentioning. Because I have to keep mentioning that. This was Heritage Foundation. This was Mitt Romney Care. But again, even with the problems that the ACA has, what they have coming, the ideas, far worse. Health savings accounts don't affect the poor. Block granting Medicaid will cut millions off needy Americans who can't afford insurance. Giving a tax break to help you get health insurance, again, that doesn't do diddly shit for the poor. Not at all. And look, the final irony about this is that many of the most conservative places that actually vote for Republicans, like Mike Lee, are poverty-stricken areas, for example, like in Appalachia and small rural towns. Those are the people that are going to be hurt worse by the repeal. But again, the Republican Party as a whole doesn't really care. They want to get rid of it so that their donors can save millions of dollars a year in taxes. This is not about choice. This is not about freedom. What it is about denying access to quality health care for poor people at the benefit of the very wealthiest Americans. That's not what the American people want. It's not what the American people believe in. The Republicans know that, and yet what they're going to do is they're going to sit and lie in your face, to your face, in meetings and at town halls. No, our plan's so much better, so much better. No, it's not. If it was, it would be called single payer, because that is the better alternative plan. Why? Because it works for every other single industrialized country in the world. If it can work for them, why can't it work for us? And the answer to that is that, well, it wouldn't work because people would no longer be able to profit off healthcare, because that's what they believe. They believe they should profit off your healthcare. These other countries that do single payer, it works for them because they don't believe that. They believe that healthcare is a right, a human right for everyone. And until we change that belief, we're never going to have a single payer system. So we've got to start changing hearts, and we've got to start changing minds. We've got to start making people realize that health is a human right. Hey everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent progressive media, please consider becoming a patron at patreon.com/TYTNation.